So which works best for you? Ibuprofen, naproxen, aspirin, acetaminophen, snake venom? It's true, many snake venoms have analgesic effects. The problem is you have to trust the snake to get the dosage right. Subscribe for more health and fitness tips based on peer-reviewed science. Hi, I'm Dr. Jake. In this video, I'm going to help you decide which over-the-counter pain medicine is best for you. So tell me, what's the most common reason you use pain medication? Headaches, muscle soreness, joint pain, other people? Drop your answer in the comments. Whatever the reason, the right choice of painkiller likely depends on the reason, because each painkiller works differently. Let's break down how they work, their pros and cons, and when to take one painkiller over the others. When you get injured, overtrained, or life throws too much at you, activated immune cells signal cytokines to release from the membranes of the damaged cells a fatty acid called arachidonic acid. This brings me to two enzymes that are important to understand when it comes to over-the-counter painkillers, COX-1 and COX-2. COX stands for cyclooxygenase. If it was called psychooxygenase, these painkillers would be known as psychokillers. Good thing. COX-1 converts arachidonic acid into prostaglandins that protect your stomach lining, keep your blood flowing, and help platelets clot when you bleed. It's like a maintenance worker who's always on the job. COX-2 is more like an emergency responder. Normally quiet, but kicks in when the immune system sounds the alarm through cytokines. Then it turns arachidonic acid into prostaglandins that further drive inflammation, causing swelling, pain sensitivity, and fever. So basically, COX-1 protects, COX-2 inflames. Both are essential, but when COX-2 kicks into overdrive, you feel pain, stiffness, and fever, part of which are necessary for healing and recovery and to tell you there's a problem. This is where NSAIDs, non-steroidal anti-inflammatory drugs, step in. They block COX enzymes, reducing prostaglandin production. Less prostaglandins means less inflammation, fever, and pain. But here's the trade-off. Most NSAIDs block both COX-1 and COX-2. So while they lower inflammation, they also reduce protective prostaglandins. That's why side effects like stomach irritation and increased bleeding risk show up, especially with long-term use. So the art of choosing an NSAID is finding one that gives you the benefit with the fewest downsides. It's like booking a cruise. You want one that relaxes you but doesn't give you food poisoning. Let's look at the most common options. First, ibuprofen, marketed as Advil and Motrin, it's the most common NSAID. It blocks both COX-1 and COX-2, cutting down on the prostaglandins that drive pain, swelling, and fever. It acts quickly, usually within 30 minutes, but only lasts 4 to 6 hours. That's why you often need multiple doses a day. Downside, like all NSAIDs, too much can upset your stomach and stress your kidneys. Next up, naproxen, sold as Aleve. Think of naproxen as ibuprofen's longer-lasting cousin. It works the same way but stays in your system much longer, 12 to 17 hours compared to ibuprofen's 2 to 4. That's because naproxen binds tightly to proteins in your blood, slowing how fast it's cleared. While ibuprofen is more for the relief of headaches and minor pains, naproxen is built for longer-lasting relief, like with chronic inflammatory conditions and arthritis. But naproxen means a slightly higher risk of GI problems that last longer, since it lasts longer. That brings me to aspirin, the OG of painkillers. Did you know aspirin comes from the natural willow bark compound salicin? Ancient Egyptians used it for pain and fever thousands of years ago. Like other NSAIDs, it blocks COX enzymes. But here's the twist. Aspirin permanently shuts down COX-1 in platelets. That reduces clotting, which is why doctors sometimes recommend low-dose aspirin to prevent heart attacks and strokes. But because COX-1 also protects your stomach, aspirin can cause more irritating and bleeding than other NSAIDs. So what about acetaminophen, sold as Tylenol? It's the oddball that really isn't an NSAID. It doesn't bind to COX-1 or COX-2, but blocks them through different mechanisms. Acetaminophen blocks prostaglandin production in the brain and spinal cord, which increases pain tolerance and reduces fever. But it doesn't reduce inflammation in the joints or muscles. Think of it this way. If prostaglandins are group text, NSAIDs block the message from being sent. Acetaminophen just mutes the notifications in your brain. The upside to acetaminophen is that it's easier on your stomach, but taking too much can overwhelm your liver, especially if alcohol is involved. While I'm here, let me just say the possible associations between acetaminophen and autism come from smaller observational studies. But when larger, more rigorous studies like the 2024 Swedish registry account for confounding factors like family and genetic influences, they find no causal link. Given that autism is strongly heritable and multifactorial, qualified experts remain cautious about overinterpreting any weak associations. So let's apply all this to your aches and pains. If you have a tension headache, acetaminophen is a safe first choice. A migraine, NSAIDs work better since inflammation around blood vessels is involved. And naproxen can be better for prevention since it lasts longer. For a fever, Both acetaminophen and ibuprofen work. Parents often choose acetaminophen for kids, but ibuprofen sometimes works faster for stubborn fevers. Period cramps are inflammation driven, so ibuprofen or naproxen beat acetaminophen. Naproxen often wins because of its long duration. At least that's what I'm told. When it comes to chronic pain like arthritis, naproxen is effective and convenient, but only once or twice per day. Ibuprofen works, but requires more frequent doses. Acetaminophen is an alternative if NSAIDs cause stomach or heart issues. For heart protection, aspirin plays a unique role. Low-dose aspirin of 81 milligrams doesn't help pain much, but with its antiplatelet effect, it reduces heart attack and stroke in some patients. So when it comes to over-the-counter pain medications, they each come with their own pros and cons. But they're all safer than snake venom, trust me. As an exercise physiologist, I'm contractually obligated to talk about delayed onset muscle soreness, also known as DOMS. That deep muscle ache 24 to 72 hours after an intense workout. For short-term relief, NSAIDs like ibuprofen and naproxen can reduce pain perception. Acetaminophen can help too, but it doesn't reduce inflammation, a key component to DOMS. You see, muscle growth and repair rely on inflammation. Studies show the regular NSAID use after workouts may blunt long-term gains by reducing satellite cell activation, a topic I covered in another video. So if the pain is going to impair short-term performance, NSAIDs can help. But if you're training for growth and adaptations, don't make them a habit. So yes, ibuprofen if your quads need help going downstairs. But if you can get through the pain with stretching, massage, and light exercise, then that's your first choice. If you've learned something new and helpful, click like and subscribe. Because these drugs are sold over the counter, it's easy to forget they carry real risks. 1. Stomach and GI bleeding, especially with aspirin. But ibuprofen and naproxen can irritate your stomach and cause ulcers. Doctors sometimes prescribe stomach-protecting meds if NSAIDs are needed long-term. 2. NSAIDs reduce kidney blood flow, which is risky if you're older, dehydrated, or already have kidney issues. Even athletes run into kidney problems during endurance events if they use NSAIDs while dehydrated. 3. I've already mentioned the liver and acetaminophen. It's safe for recommended doses, but dangerous about 4,000 milligrams per day or when combined with alcohol. 4. High-dose chronic NSAID use may increase the risk of heart attack or stroke. Naproxen may be safer, but evidence is mixed. Aspirin's unique. It raises bleeding risk in the stomach, brain, or really anywhere, but at low doses protects against heart attacks. 5. NSAIDs can interfere with blood pressure meds, and combining NSAIDs at once doesn't boost relief. Just side effects. The best approach is to use the lowest effective dose for the shortest necessary time. So here's what you get when you combine all the research. For headaches, acetaminophen for tension, NSAIDs for migraines. My dad took both when my sister crashed his car into a cow. Not kidding, a cow. Right, Mary? For fever, either works. Acetaminophen is stomach-friendly. Ibuprofen is sometimes stronger. Sore muscles and joints, NSAIDs if there's inflammation or swelling, and acetaminophen for general aches. Period cramps, naproxen is a strong, long-lasting option. Arthritis or chronic pain, naproxen means fewer doses, but go with acetaminophen if NSAIDs cause issues. Heart protection, low-dose aspirin, but only under medical advice. The truth is, the best painkiller isn't the one you hear about the most. It's the one you need the least often, at the lowest doses, and for the shortest time, but still works. Smart pain med use keeps you healthier in the long run. If you've learned something new today, subscribe and share your thoughts in the comments. And share with someone you know who uses over-the-counter pain medication maybe too much. Thanks for watching. And as always, my answers come from peer-reviewed research.